Hello, my name is Madeline Wilson, and today I'll be sharing my presentation, Same Minds, Different Needs, a global health proposal focused on autism and educational access, focused on supporting students with autism through flexible learning. I just want to start off by talking a little bit about myself. I am a rising junior at Pasadena High School in Pasadena, California. I am extremely involved within my school's clubs and programs, some of my most noteworthy being my position as vice president for my school's public health club. I am one of the first junior leads for my yearbook team and have been playing varsity volleyball for the past 2 years. I also love volunteering and giving back to my community. I am a youth leader for the Pasadena Education Foundation, where I volunteer with children ranging from kinder to eighth grade, helping them in the classroom. I also volunteer at the Huntington Hospital in the post-surgical department. And last summer, I attended the Clinical Neuroscience Immersive Experience at Stanford University, where I was first introduced into the world of neuroscience through lectures from world-renowned scientists and did a research project as well as concluded the entire program by presenting a capstone project centered around amending the IDEA or IDEA Act to advocate for better education for children with autism in California. I'm passionate about helping the youth and paving the way for a brighter and more successful future. I'm interested in neuroscience as well as public health and education in general. Now, I'm just going to talk a little bit about what is autism and ASD or autism spectrum disorder. So, autism spectrum disorder is a neurodevelopmental condition that encompasses a large group of conditions related to the development of the brain. It affects how a person communicates, interacts, and learns. It's called a spectrum because it presents differently in every individual. Some autistic students might be nonverbal, while others are highly verbal but experience sensory sensitivity, anxiety, or trouble with social cues. According to the World Health Organization, roughly 1 in 100 children globally are on the autism spectrum, but that number is very likely much higher due to the underdiagnoses, especially in low income or underserved regions. It often exists as a comorbidity, which means it is diagnosed with other conditions such as ADHD or anxiety. This does make assessing the medical needs of a child a little difficult sometimes. So now, why is autism a global health issue? Children with autism often go undiagnosed or unsupported, especially in countries with limited healthcare systems. In many low and middle income countries, there might be fewer than one trained child psychiatrist per million children, and even in basic developmental screenings aren't always available. This results in a lifetime of disadvantages, not just academically, but in employment and social integration and mental health as well. Um, Even in the US, children from marginalized communities often wait years for a proper diagnosis or support plan, and this creates a growing global equality issue, which I think is a clear public health concern. Now, I want to talk a little bit about the problems in schools. A major barrier that students with autism face is how they're taught and evaluated in schools. Many students with autism fail not because of ability, but because teaching methods don't meet their needs. Too often, schools rely on a one size fits all assessments, like long essays, group presentations, or timed exams. But for students who struggle with reading, writing, or processing under pressure, these formats don't always reflect their true understanding. In the US, Canada, the UK, and I believe Saudi Arabia, individualized education plans or IEPs do exist, but in many other countries, there's no such program, and if there is one, it's not always heavily enforced. In my Stanford capstone project, we explored how IEPs can be used to adapt assignments for students with autism. We found that while these plans are legally required in the US, they're not often applied or they're underfunded or unevenly applied. And many countries don't have IEPs at all. This means that students are failing not because they don't understand the material, but rather because they're not given a chance to demonstrate their knowledge in a format that works for them. So now I want to talk about my solution, which is flexible accommodations. My proposal is as simple as integrating flexible learning accommodations into education systems as a core public health strategy. This would mean allowing students to complete assignments in different formats, such as writing, spoken, visual, or interactive, based on what they need. This isn't about making things easier, it's just about making learning accessible. It's a low, scalable intervention that improves outcomes for autistic students in both high resource and low resource settings. And it's something teachers can start using right away. They don't have to wait if we provide them with the right tools, which leads me into my next slide. To make this idea actionable on a global scale, I propose the creation of a global accessibility toolkit, which would be a free open access set of resources to help teachers support neurodiverse learners. The toolkit would include assignment templates that offer multiple response formats, guides to help identify common signs of autism, examples of classroom accommodations that work in low resource settings, and translations and adaptations for different languages as well as cultures. This could be digitally distributed through organizations such as UNICEF or HWO or WHO, or even printed and shared in communities where internet access is limited. Most importantly, it would be developed with input from neurodivergent students themselves. This is just to ensure that it's not just inclusive, but respectful and empowering. So now, what is the bigger picture? Why is this public health and not just education? Because when students go unsupported, they often experience chronic stress, anxiety, and isolation. They're more likely to drop out, face unemployment, and have long-term mental health challenges. By creating systems that support children with autism early on, we prevent these outcomes. Education and healthcare for many kids is the only consistent support they get. And as a student, I may not control policy yet, but I do have a voice. Through my public health club, my Stanford experience, and programs like this, I hope to keep advocating for inclusive environments that help all students succeed, especially the ones that are misunderstood or underrepresented. Now, I would love to thank the Global Health Leaders Conference for this amazing opportunity. Also want to thank CNIX, the program at Stanford, and lastly, my family and everybody watching. I'm beyond thankful for your support and interest in my presentation and research. Now, here are my references. Thank you so much for listening. That concludes my presentation.